Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. We all feel a little down or sad at some point in our lives, but depression is more than just feeling blue. Depression is a common but serious disorder that needs treatment. It's a real illness that affects how you think and feel and handle daily activities like sleeping or eating. And depression is not something you can just snap out of. To learn more, I'm joined by two medical experts from the University of Vermont. Dr. Michael Lamantia is head of geriatric medicine at UVM Medical Center, and he is the director of the university's Center on Aging. Dr. Jennifer Hall is also with the Medical Center. She specializes in geriatric psychiatry. Thank you both for coming in and helping us separate kind of fact from fiction.
Thank you for having
about
us.
depression.
Thank you.
It's terrific. So let's start out with asking you, Dr. Lamantia, about just describe symptoms that you might see of depression.
Sure. I think that this is one of the key things that we can do as doctors for our patients is talk with them about the things they may notice in themselves if they were to start to become depressed. So I think commonly people think of depression as just feeling down and blue. And while that certainly can be a common symptom that we recognize in ourselves, older people sometimes feel differently or exhibit depression differently. They may notice that they have less interest in doing the things that they used to do. They may feel more tired or fatigued. They may feel that they are more cranky or have a shorter temper than they did before. They may feel like they don't want to participate in the same activities that they did before. So these are the things that one might notice in oneself as being different.
And is that different from symptoms that or signs that someone else with a loved one might notice, with a loved one or friend or colleague? What do we notice on the outside?
Right. So if you are a family member of somebody who's exhibiting these types of symptoms, you might see that they stop participating in the activities that they used to do, that they're sleeping more, that they're eating more or they're eating less, that they're preferring to spend the time just to themselves rather than engaging in activities that they used to enjoy.
And that might not be normal. I mean, some people might think this is a normal thing for aging. You sleep a little bit more, you maybe don't want to do everything you used to do.
Well, so that's exactly it, is that the problem or the reason that depression is so hard to treat in older adults is really this issue of people accepting inappropriately the fact that this is just a normal part of aging. It is not normal as you get older to feel depressed and to not have the same joy that you found in daily life before.
Right. And Dr. Jennifer Hall, people often think of depression as a condition of teenagers and young people because it's very tragic and very concerning. But how common is depression in older adults?
Depression is actually very common in this patient population, although sometimes rates of depression can vary, and that may depend on where the older adult lives. So for example, an older adult who may live independently in the community can have depression rates as high as 10 to 15%.
Wow.
But in comparison to those older adults who may be living in nursing homes or assisted living facilities, depression rates can be as high as 40 to 60%. So can be great variability as far as depression rates.
So, Michael, what are the causes of depression? What can cause these episodes?
So depression is really a complex issue to deal with, and it's caused by quite a number of things. The old adage that this is just a problem with chemical imbalance in your brain is not really telling the whole story. While chemicals in the brain may play some part in it, it's also a combination of factors. Your life history, your history of whether or not you've had depression before, your genetics, the life events that you face. All of these can play an important role in determining whether or not, when faced with a certain set of circumstances in your life, you're likely to become depressed.
So, Jennifer, some risk factors. What are some of those risk factors that
So some of the
started
risk factors that Dr. Lamantia already mentioned were things like genetics. So for example, if you have a family history or strong family history of multiple family members having depression, you may have an increased risk for depression yourself, including your personal history. So if you have experienced depressive episodes earlier on in life, you are at increased risk for developing future depressive episodes. And then there are certainly life stressors, because we cannot discount those. And some common life stressors include loss of a loved one, death of a spouse. But there are also other things like financial hardship that can increase one's risk for depression, as well as sometimes experiencing changes that we anticipate happening with normal aging, including retirement.
So that life change. So when you say depressive episode, is that different from kind of tragedy in one's life, which you also talk about? So that's having a time in your life when you were severely depressed.
Correct. So clinically, we define a depressive episode of certain depressive symptoms that are persistent and constant, that interfere with day-to-day functioning. So that may include things like, you know, your ability to get up every morning, walk the dog, prepare a meal for yourself, all of these which are not a normal part of aging. And those are risk factors.
Well, let's talk about that normal part of aging. It's not uncommon as we get older to face multiple health issues, to have more loss, more friends and family have died, or these, and we're going to feel down about that. It's normal to feel depressed in a non-clinical way. So how do we separate that serious depression from something that's just a life episode is causing some real stress?
So certainly when we face a change in our life circumstances, there's a period of time in which we think that we have to adjust to that, and we have to find a way of sort of processing those changes. The concern arises for us when that starts to last longer than a reasonable amount of time. And so depending upon what the stress is and the severity of it, and what resources we seek to help us process those emotions, we give varying degrees of sort of time to process those emotions. So for example, you know, if you were to lose your spouse, you know, it would be normal for you to be sad in and around the time of the person's death and the funeral arrangements. But if that were to start lasting more than a month or two, and you had adequate access to counseling, and you had adequate support from your family, then that would be something that we would become concerned about. However, there are sometimes people who we see who will have a loss of a spouse, and they exhibit these depressive symptoms, and they've never gotten counseling, and they went into a very non-supportive environment. They all of a sudden found themselves on their own. We're concerned about depression in those people, but they haven't processed the loss appropriately. So sometimes our approach to how we treat it depends upon what resources people have been offered along the way.
Right. Well, that's such a good point. So talk a little bit about resources that people should look for when they have had great loss in their life.
Well, I think some of the resources that you can certainly utilize would be family and friends who may also be experiencing similar sadness or depression related to that loss, but also the resource of your primary care provider, and really being able to reach out to them and talk about some of the symptoms that you may be experiencing, as well as different therapeutic supports. And that can include you know, having an individual therapist or counselor that might be able to help you process that emotion. And then sometimes people can also find a lot of great support in their faith community.
What about treatments for depression, Michael, or specifically for older people?
Right. So there are a variety of treatments that work well for older adults. And in fact, when we take a look at the treatments that we use in older adults, they mirror in many ways what we use among younger adults too.
So it isn't that different.
So it isn't that different. Medications work very well. They need to be personalized in conversation with your doctor. And when you start a medicine, you need to make sure that you're checking back in with your doctor to make sure that the doses are adjusted correctly, and to make sure that the medicine is actually working for you. Because in the long run, if a medicine doesn't work for you, we need to rethink our approach to this.
Right. And so what should someone do if they're concerned that a loved one might be depressed? What are the first steps that they might take, Jennifer?
So I think some of the first steps that one could take would actually be expressing concern to that individual loved one, being able to say to the person that I'm noticing changes and I'm worried or concerned that you may be depressed. The other thing that one could do is help support that individual in actually seeking help. So probably the first person, again, to reach out to would be that primary care provider to really do the initial assessment.
And if in a more severe circumstance, you're concerned that that person might harm themselves.
So the first thing to do in that type of situation is not to be afraid to talk about this with them. Talking about concerns about somebody harming themselves is not going to cause them to actually harm themselves. Bringing it up and bringing this into the light is one of the first steps. Being there with them, encouraging them to get help, and if you're concerned about somebody doing something imminently, getting them to help, even if it means accompanying them to some place like the emergency department, or if you can't get them there yourself, calling 911 and asking the authorities to come and help you get help for that person.
Great advice on this. I'm sorry we're already out of time. We want to make sure that you have a recommendation for a resource for depression from the National Institute on Aging. So we're going to highlight that website. You can go to nia.nih.gov. That's nia.nih.gov. And then you click on a box. There's a search site. You just put depression there. So again, go to that website and write in depression in the search, and there'll be more resources there. Thank you so much, Dr. Michael Lamantia and Dr. Jennifer Hall, for coming in with us today and talking about a very important and serious subject of depression.
Thank you so much for having us.
And thank you for joining us across the fence. I'm Fran Stoddard.